I'm Craig Smaler, RN, Senior Housing Nurse for Newbridge Services, and this is a heat-related medication training. You can help prevent heat-related illnesses from affecting your clients. The important thing is to tell them repeatedly to stay well hydrated and to make sure that the body can get rid of the extra heat, and for them to be sensible about physical exertion and exercise in hot and humid weather. This is how your body works to get rid of heat. The hypothalamus in our brains closely monitors our temperature. When we're too hot, we sweat so that the evaporation can cool us. Our kidneys adjust the concentration of various components of our fluids, especially essential salts like sodium and potassium. Your sweat is your body's main system for getting rid of extra heat. When you sweat, the water evaporates from your skin and carries the heat away from your body. If you do not sweat enough, you cannot get rid of the extra heat and your body becomes dangerously hot. Dehydration will make it harder for you to get cool. If the air is humid and muggy, it's harder for your sweat to evaporate. This means that your body cannot get rid of the extra heat as easily as, say, when the air is dry with low humidity. Some drugs keep the body from increasing the blood flow to the skin. Certain psychiatric medications may block the body's message to the brain regarding elevated temperature. Clients taking antidepressants, antipsychotic medications, medications prescribed for their side effects, and lithium medications need to be especially cautious in hot and humid weather conditions. With dehydration, medication blood levels can become dangerously high. Stimulants and decongestants actually reduce blood flow to the skin. Water pills, alcoholic beverages, and products containing caffeine, including coffee or sodas, may cause more dehydration to occur. Certain blood pressure medications may increase the likelihood of dizziness and lightheadedness as the body responds negatively to the heat. Sweating is an important way the body stays cool. Some medications may reduce sweating, such as antidepressants, cold and allergy medications. Some medications may cloud their judgment, and their ability to deal safely with the heat may be impaired. The best fluid to drink when you are sweating is water. Although there's a little salt in your sweat, you don't really lose that much salt with your sweat. Sports drinks such as Gatorade will also work, but water is inexpensive and usually easier to obtain. Encourage your clients to avoid coffee, tea, caffeine sodas, and alcohol when the weather is very hot and very humid. And any kind of drinkable water, tap water or bottled spring water, will work. There are bottled waters around that have extra minerals and other things, and in some cases they may be beneficial for you. But plain water works just fine. Just keep drinking it frequently, all day and night when it's hot and humid. Now, reactions due to the exposure to the sun, such as photosensitivity. Some drugs may cause clients to burn more easily, a reaction known as photosensitivity. The most common form of photosensitivity is a phototoxic reaction, or sunburn. A phototoxic reaction of sunburn usually involves redness and tenderness of the skin and generally occurs 2 to 6 hours after being out in the sun. The sunburn reaction may be as severe as blistering. Sunlight emits ultraviolet rays, and it's these rays are what cause the phototoxic sunburn skin reaction. That is why you should encourage your clients to put on a sunscreen or a sunblock lotion product with an SPF of 15 to 45 before going outside. And to heal and cool their sunburned skin, a pain-relieving gel or lotion of aloe vera and lidocaine will help. Heat exhaustion. Although partly due to exhaustion and feeling like exhaustion as the name implies, heat exhaustion is also a result of excessive heat and dehydration. The signs of heat exhaustion include wet, sweaty, pale skin, dizziness, nausea, vomiting, fainting, and a moderately increased temperature of 101 to 102 degrees Fahrenheit, which in this case is not truly a fever but is caused by the heat itself. Rest in water may help in mild heat exhaustion with ice drinks and placing the client in a cool, air-conditioned environment with a fan blowing on them. More severely exhausted clients may need IV fluids. And if a heat-exhausted client's vomiting keeps them from drinking water or other fluids, you should call 911. Heat stroke. Heat stroke is the most severe form of heat illness. It can occur if the weather is hot enough. These clients have a dry, warm, flushed red skin and do not sweat. A person with heat stroke usually has a very high temperature of 103 to 106 degrees Fahrenheit or higher and may be unconscious or delirious, confused, agitated, or having seizures that can lead to their death. These clients need to have their temperature reduced quickly, often with ice packs, and must also be given IV fluids for rehydration. They must be taken to the hospital as quickly as possible and may have to stay in the hospital for observation since many different body organs can fail in heat stroke. If you see these symptoms, call 911. Heat stroke is a very dangerous medical emergency. In summary, clients should avoid excessive summertime heat. They should stay indoors with air conditioning. And if they go outside, they should stay in the shade. They should be encouraged repeatedly to drink water and sports drinks to help keep replenishing their fluids that are lost to sweating. Remember, in heat exhaustion, the client is still sweating and has a wet, pale skin. In heat stroke, the client has stopped sweating and their skin is dry and flushed red. This is a 911 call. The test for the heat-related medication training. Question 1. You can help to prevent heat-related illnesses from affecting your clients by telling them repeatedly to stay well hydrated with water. True or false? Question 2. The hypothalamus in our brains closely monitors our temperature. When we're too hot, we sweat so that the evaporation of the water can cool us. True or false? The best fluids, question 3, the best fluids for a client to drink are a combination of an iced coffee, a cold caffeine soda, and a cool alcoholic beverage, such as a nice cold beer. True or false? Question 4. Your sweating system is your body's main method for getting rid of your extra body heat. True or false? Question 5. A phototoxic reaction, sunburn, usually involves redness and tenderness of the skin and generally occurs 2 to 6 hours after being out at nighttime. True or false? Question 6. The signs of heat exhaustion include wet, sweaty, pale skin, dizziness, nausea, vomiting, fainting, and a moderately increased temperature between 101 and 102 degrees Fahrenheit. True or false? Question 7. Sometimes, when a client has heat exhaustion, they may vomit so frequently that they cannot drink water or other fluids. Call 911 immediately. True or false? Question 8. Heat exhaustion is more severe than heat stroke. True or false? Question 9. If the client is suffering from heat stroke, then the client will have a dry, warm, flushed red skin and will not be sweating. Call 911 immediately. True or false? Question 10. Heat stroke clients can have a very high temperature of between 103 to 106 degrees Fahrenheit or higher, and may be unconscious, delirious, confused, agitated, or having seizures that can lead to their death. Call 911 immediately. True or false? This concludes the heat-related medication training in service. Thank you.